Okay, hi. I am Deborah Krasaniak. I'm the program director for the Cytotechnology program at Old Dominion University. And today we have a panel of one of our alumni from the program and one of our current students. So today we're going to be exploring why they chose the field of cytotechnology, and we're going to ask them some questions. So I'd like to introduce Lindsay Hancock. She is an alumni from the program from 2017, and she's been out there in the working world. So she's going to tell you about her experience. And then we have Brittany Jones. Brittany Jones is a current student in the program. So I guess we could start with both of you answering the question to tell us about yourself and why you chose a career or why you chose the field of cytotechnology. Lindsay, do you want to go first?
Sure, I'll go first. So,
Okay.
hi, I'm Lindsay Hancock, and I decided to pursue a degree in cytology because I knew I wanted a job that would make an impact on the world. I knew I wanted to do something in a healthcare field, but I also wanted a job that was going to have flexible, kind of normal hours. So, I remember one of my biggest fears as a student was that after I graduated, I wouldn't be able to find a job. My husband's in the military, so I wanted a career that was going to be readily hiring and available when we would change duty stations. So I felt that a career in cytology was good for me, and that's kind of why I pursued it.
Great. What about you, Brittany?
Um, I started doing cytology because I had been trying different things in medicine since I was about 14. I've been working in different jobs all over the hospitals and never really found my niche. I didn't really want to be a nurse, and I didn't really want to be a doctor, but I did want to help patients. And so I ended up in the laboratories, and I ended up working in cytology and seeing what they were doing every day. And it was just so interesting that I was hooked and ended up applying to the program to become a cytotechnologist.
Okay, well, the second question is really pointed towards you, Brittany. Since you're a current student, what has been your experience? Now, I know this year we've had the COVID-19, which is something we've never experienced before, but tell us what your experience since you started the program last August with the prereqs and this semester. What has your experience been like?
It's been a really good experience to state out, I guess, initially. There is a lot of work, a lot of reading, and you have to kind of dedicate yourself to it fully. It's not something to be done part-time, but it is fascinating right from the get-go, which is something that I found when I went to college previously was not true. Many majors are not interesting until you get into the very, very depths of it, where this is interesting immediately. We learn about just the whys of pathology as far as the way our cells react and what that means for the rest of us, which is fascinating. Because we have a smaller program, we also have a real great relationship between each other as well as with the faculty and staff. I feel like it's wonderful.
Good. Okay, thank you, Brittany. Now, Lindsay, you've been out in the working world. I know that you went to work, you took the registry like the Monday after graduation and went to work right away. So tell us about the day-to-day operations of the laboratory department and your role as a cytotechnologist.
So I've worked at 2 different hospitals since graduating, and both places were kind of a little bit different as far as the workload, but the job duties are pretty much the same. So some hospitals you'll have a prep tech that's going to prepare your slides and accession your work for you, while other places you might have to do the responsibilities of processing your own slides. So day to day, I'd say that on an average you would screen probably 20 to 30 pap smears. And your non-GYN work, which is other body fluids such as your urines, your lung, your breast, pancreas, thyroids, they kind of fluctuate based on your procedure load for the week. So another responsibility that you might have to do is going on biopsy procedures. At Riverside, I went on thyroids, probably 2 thyroids a day. go on lung biopsies, just different procedures like that. But you learn a lot about what type of work environment you want to be in throughout the program when you get to go on those rotations. I opted to do the hospital route because it's kind of, you don't have to sit at a desk all day. You kind of get to explore the hospital and see different things, whereas maybe at a private lab, you would just be looking at GYN pap smears. So
Right.
it's definitely a great career though.
That's great. So back to Brittany. Brittany, what advice as a current student would you give to someone that was considering this program or the field of cytotechnology?
I guess I'd probably ask them to confirm with themselves what kind of person they are as far as what kind of work they like to do. Because this is the kind of work where you have to be really focused, you have to be detail oriented. Things in cytology and the microscope, they can be subtle. So if you're the kind of person who is more of a broad scope, doesn't really necessarily pay attention to details, this may not be right for you. But if you are that person, like I am, it is awesome because it is like every day doing a treasure hunt on a slide. So that's one of the things I would definitely take into consideration. Do you like to focus on those things? And can you sit still and look at a scope for hours on end?
That's good advice. Thank you. What about you, Lindsay? What kind of advice? You have a little experience, plus I'm sure those long days at school and all of that reading. I'm sure you haven't forgotten it. So tell us what kind of advice would you give?
My advice for any incoming students is that although it's a really challenging program, if you do give it all your effort, you're learning such a cool skill that is so rare and meaningful. And I mean, you're going to be set for a great career. People will be out looking for you because it's just such a rare thing that we're doing. But if you just give it your all and study every day, then you'll be sure to come out just like us.
Yeah, and so we are having kind of a shortage right now. There's about a 15% vacancy across the US. So when you recently started looking for a job, did you have a problem finding anything?
I think it's all about location, because I know near the ODU area, it's kind of hard to find jobs there, but everywhere else that I've had to move, I haven't had a problem at all finding a job.
Okay, great. Okay, so part of the prerequisites to get into the cytology program are required by the accrediting agency, our national agency, which is the American Society of Cytopathology. They require 20 hours of biology, 8 hours of chemistry in order to get a bachelor's degree in cytotechnology or a post-baccalaureate certificate. So those courses, could either one of you students or former students, alumni, or Brittany, the current student, could you tell us why those courses, why did you feel like a background in biology was important to learn cytology?
Well, part of the reason that the background in biology specifically, even more so than the others, is because that's what we're dealing with. You're going to be learning the very basics of it, but as you get further and further along, we're talking about cellular level stuff, which when you learn the basics of biology, you're learning a very broader scope. This is going to be telling you why all of that happens. So if you don't have that foundation, you're going to kind of be sitting there going, and? Same thing with chemistry. Again, we may not be doing details with chemistry every day, but you're going to need to have the fundamentals of understanding how things react and pHs and how to deal with chemicals, because we deal with chemicals every day. So I do think that's important.
Okay, thank you. How about you, Lindsay? I know it's been a while since you've taken your prerequisites, but did you feel like those were important in learning cytology?
I do. I feel like the most important class that I took before doing the cytology program would be the anatomy course. You kind of have to have an understanding of where things are on the body when you're doing cytology, because you're getting specimens from all over the body. And I just think you know, if you don't take those classes, you might be a little bit lost when you begin the program, because it does kind of start out at a higher level than those classes. So I think it's important to really have a base understanding of just certain courses like biology and anatomy.
Thank you. I appreciate that. Well, is there anything else that y'all would like to say about the program, or any advice you'd like to give to anyone just contemplating cytology?
I can't really think of anything else.
I think you covered it all. Okay, well, thank you so much for taking time to be on this panel, and I really appreciate it. And I appreciate you, and thank you for being here and taking time to do it.